Let's switch gears back to Yola, Adamawa State, where Aishat Salihu is live and she's been monitoring the suspected Buruli Ulcer outbreak in the state. And she joins us now to give us update. Aishat, what's the situation like at this time, especially for residents?
Thank you so much, Judith. Currently, I'm in Yola, the Adamawa state capital, and it's currently 32 degrees Celsius. The temperature is really very hot. But away from that particular weather update, yesterday we visited the community where this particular disease, suspected Buruli Ulcer outbreak, is currently ravaging. And then we spoke to most of the affected persons, and they shared some really horrifying stories with us, where they are saying there are fears for their lives because some of them had even lost some close family members, and then they are saying that they feel that there is some form of transmission of this particular infection because some members of their families had it, and then within weeks they also contracted the disease. Yesterday, whilst we were there, the health officials came and then they delivered some health commodities, which they said for the primary healthcare facility in the community they should use in treating the wounds from the skin. But technically what we are seeing is that this particular disease is really ravaging that community, and there is also the issue of underreporting of this disease, and there is also misconception that has even come to play. So many of the residents are unwilling and refusing to even come to the healthcare facility to seek medical attention, medical treatment. Although the state says that they have taken the sample to the NCDC, awaiting laboratory confirmation as to what they are really dealing with. But it just means that the residents are left to their own fate for now, especially for that community where access to healthcare, even the basic infrastructure, even the road network leading to that community is really terrible. But we have it on record that some persons have been brought to the Modibbo Adama University Teaching Hospital for treatment.
Now, speaking of the university for treatments, were you able to visit the hospitals? What's it looking like for those who are in the hospital?
So earlier this morning, we visited the Modibbo Adama University Teaching Hospital. We're hoping to, meet with the CMD of the hospital and also visit the patients. But we're told that the patients are currently reserved at the isolation center, the infectious disease and isolation center, where they are being closely monitored. But from what I can say and what we noticed on ground, although the official who spoke with us said the patients are responding to treatment, but then there is this form of they are not really allowing us to know what the real situation is, because we're supposed to even stand in front of the hospital and establish our presence there and speak with residents. But they are saying that due to some concerns, maybe they're trying, I don't know if there is any form of cover-up or whatever is going on, but then they didn't even really give us that information that we're looking for. But then for residents who are in Yola, they are aware that this disease is ravaging. But although the disease is really localized at the Malabu community at the moment, not in the state capital, but since there is fear, it may be infectious. But until we hear from the Nigeria Center for Disease Control, until they return the results from the lab, the state health officials are saying they can't really tell what the situation of the disease is, but they are just treating wounds, and they are saying that there has been some progress made.
Aishat, thank you so much for that update. I mean, with 6 persons already dead, time is really on our side to sort of help when it comes to misinformation and, fear about this disease. I want to say thank you once again, Aishat Salihu, they are correspondent live from Yola, the capital in Adamawa State, following the outbreak of Buruli Ulcer disease.